May I first congratulate you on your achievement. You will shortly commence your internship, and once you receive the certificate of good standing from the Sri Lanka Medical Council, you're going to be fully pledged doctors. This is a faculty I served for 22 years as a teacher, a clinical surgeon, and later as an administrator. Some of the alumni of this faculty are shining stars in their respective disciplines, serving locally and globally, and I see some of them seated as distinguished faculty members. However, the things are somewhat different today. During the last decade or so, all medical faculties have gone through a turbulent period, and students have sailed through during these stormy times are now entering into practice medicine at a time when Sri Lanka is at crossroads. During the last decade, you witnessed many student unrests and experienced the effects of COVID pandemic. The society we live in is extremely sensitized. In this environment, the patient expectations and perceptions of the society regarding the doctor's conduct to have radically changed. Today, one's highly respected profession is challenged to serve in a country saddled with grave economic problems. Therefore, as a committed teacher, a parent, and on behalf of our patients we serve, I thought I should speak frankly, with uttermost sincerity, and say what I need to say. During your period of medical training, you were guided by an excellent faculty. You're fortunate to have quality, faculty-based and hospital-based infrastructure facilities. During your training, you were exposed to an array of excellent clinical material, as good as any country could provide. Even if COVID pandemic affected your clinical training programs, you will gain further clinical skills and clinical decision-making abilities during your internship, so you don't have to worry. During the last 5 years, you have been given an adequate medical knowledge together with a set of clinical, procedural, and communication skills. I believe that your curricular and extracurricular experiences would have helped to develop your attitudes and right mindset. And now you have become true KSAM graduate, that is, graduates equipped with knowledge, skills, attitudes, and the right mindset. I have no doubt that you all want to be good doctors. You want to be successful and live a decent life. I'm sure that's what your parents wanted you to do as well. Today, you are entering the profession at a time when there is a substantial change in the societal expectations of doctors. Gone are the days of the autonomous clinician. And that was time when doctors were treated with utmost respect. And all mishaps by doctors were treated as simply inevitable. No questions were asked. This era is long gone. Irrespective of the faculty you have graduated, by the time you get your full registration in Sri Lanka Medical Council, it is well accepted that you have got an adequate knowledge and set of clinical and procedural skills sufficient for a safe clinical practice. However, your clients, the patients, would assess you on your behavior, which is influenced by your attitudes and your mindset, which you have developed during this journey. You have gained not only these attributes, you have gained not only from your curricular activities and rigorous assessments, but also with your exposure to a variety of extracurricular activities, your sports, your experiences from participating in student organizations, student union activities, from your mentors, teachers, and of course, from your parents and relatives. How it is you who will have to serve and accept the responsibility for your performance in a sensitized patient environment, especially in Sri Lanka, where patients and societal perceptions regarding the conduct of doctors is suboptimal, to say the least. Your job the doctoring, is different, therefore, from all other professions because you are serving a population with a different set of expectations, a physically and emotionally stressed and charged set of clients who flock to our hospitals expecting miracles, hoping that their dear ones will be kept alive. These difficult times, therefore, have a profound impact on their behaviors. Most of you, or maybe almost all of you, have one important attribute, and that is an innate behavior intended to help another. We as teachers cannot teach you that behavior, but we can only emulate. However, this attribute can diminish either purposely or otherwise due to adverse environmental factors which you have got exposed during this tremulous journey. And as a result of the impact of the malignant type of competition in Sri Lanka to enter the field of state medical training. At the same time, through perseverance and resilience, one can strengthen these innate abilities. Pro-social behaviors such as empathy and mindfulness are extremely important to heal sick. Another essential attribute that helps you to respond to such tense situations is self-regulation of your behavior. During your interpersonal interactions with your patients and their families, you must always demonstrate utmost respect, humanity, and compassion to your patients' needs. As intended by our founding fathers, it is believed that medicine is the most humane of all sciences. Science without humanity is one of the 7 deadly sins identified by the great teacher Mahatma Gandhi. Let me now be more precise and tell you the crude reality of the high-risk environment we are faced, which you're going to enter very soon, with some evidence. I'll tell you a story. Years ago, when I was in the faculty, there was a student, a girl, who went through the faculty with ease. She was a good student. I can still remember her. A bright child, with a degree of naivety which you would expect from a girl of that age. Following her internship, she was posted as a MOH, or Medical Officer of Health, and was conducting an antenatal clinic in a very peripheral MOH station in Sri Lanka. A pregnant lady with her husband was to enter the room. The story goes that the assistant, before the couple entered the room, sensitized this young lady doctor's mind, saying, "Madam, this is a man who gave us a lot of trouble during the last visit." With this mindset, she saw the couple. There was an argument, and this mentally unstable ex-soldier shot her to death. Another incident it's one which became viral in the social media and also in the mainstream media only a few months ago. I'm sure some of you may have seen this. A father brought a child to a peripheral hospital. He was unhappy that there was some delay in the attending to this sick child, as any parent would be, and was agitating for attention. Like the first incident, minor staff went and complained to the doctor, and unfortunately, with all the communication skills he would have acquired during his training, in the heat of the moment, he forgot all and ordered the father to leave immediately in a stern voice. And in the social media and also in the mainstream media, we all heard that and also saw what happened immediately after that. What he said clearly hypersensitized the already sensitized father, who responded with a thundering slap on the doctor. However, these are only a few extreme lessons we should ponder and learn from in your journey to success. Let's look at the good side of it. You are entering the best and still one of the most noble professions in the world. We are blessed in our profession. This profession brings you wealth, success, and happiness. However, like anything else in life, our practice too may bring certain drawbacks which you may not recognize due to the busy lifestyle you are going to embark very soon. These real life stories provide you at least some evidence. You're trained to be healthcare professionals. And yet, sometimes your behavior under pressure and stressful conditions may show to the world that you do not know how exactly they, the patients, feel. So my challenge to you is to always be able to put the patient's shoes, because the pain, anxiety, and the fear is very real to them, even though it may not be real to you when you are stressed while performing your duties. So do think about it, that you can reach out to these people who are in need. Whatever you do can make a very big difference to them. When you show a genuine care and empathy, the response you receive in turn is true happiness, an innate feeling which no one can acquire with any amount of material wealth. Never let the society around you to dictate what to do. My advice to all of you is never compete with others during your journey, but you must always compete with yourself. Your parents and grandparents will never advise you to get involved in wildcat strikes, endangering the lives of patients. That will never bring you happiness, I can tell you. I sincerely hope that you will get the best happiness you deserve by practicing this noble profession as best as you can. You all have a bright future ahead of you. You're about to begin an incredible journey that will not only change your life, but the lives of thousands of others through patient care. We are certain that you will leave this faculty armed with knowledge, skills, and set of values as a good doctor, and level of professionalism and commitment to make a difference in yourself, your country, and to the world. My dear students, all what I stated is stated with uttermost sincerity and only thinking of your success and your happiness. I also sincerely wish that all of you will find that happiness, understand the beauty of self-empowerment, and will have the strength and the courage to reach the pinnacle in your chosen fields of interest soon in the future. May I again most sincerely thank my friend, respected Dean Professor Alukupatiran, and the Vice Chancellor of the University and all my colleagues in this faculty for giving me the opportunity to speak to you. Thank you.